Our bodies give us small warning signs when something is wrong. If you notice a black line on your nail, swollen neck veins, uneven pupils, dents on your lower back, a hump on your upper back, clubbed fingers, red palms, a swollen belly, or sudden hair loss, don't ignore them. These changes could mean serious health problems like cancer, heart failure, or organ damage. This video explores some body warning signs that could point to serious health issues. If you notice any of them, don't ignore it. Talk to a doctor as soon as possible. Recognizing these signs early could save your life. Here are a few examples. Buffalo hump. A buffalo hump is a rounded, fatty lump that forms at the back of your neck or between your shoulders. While it might seem like just extra fat or bad posture, it can actually be a sign of a deeper health issue. One common cause is Cushing's syndrome, a condition where your body produces too much cortisol, a hormone related to stress. Too much cortisol can cause fat to build up in unusual places, like the back of the neck, while other parts of your body, such as your arms and legs, may become thinner. You might also notice purple stretch marks on your skin, your face becoming round and puffy, often called a moon face, or that you bruise easily even without injury. Sometimes a buffalo hump can also be caused by long-term use of steroid medications, certain hormonal disorders, or rare tumors. If you see this kind of fat buildup, especially along with other strange body changes, it's very important to talk to a doctor. Early diagnosis can help manage the underlying condition before it leads to more serious problems. Small dents on your lower back. Some people naturally have small dimples or indentations on their lower back, especially near the top of the buttocks, and these are usually harmless. However, if you suddenly notice new dents, especially if they appear red, swollen, warm to the touch, or painful, they could be a sign of something more serious. These symptoms might point to an infection, such as an abscess forming under the skin. In rare cases, it could also indicate a pilonidal cyst, which is a painful lump that can develop near the tailbone and sometimes becomes infected. Other possibilities include inflammation, a hematoma, blood clot under the skin, or other underlying tissue problems. If the area is tender, warm, or starts oozing pus, it means your body is reacting to a problem that needs medical attention. Don't ignore these signs, especially if they come on suddenly or worsen over time. Getting it checked early can help prevent complications and ensure the right treatment. Bulging eyes. If your eyes seem to be sticking out or appear unusually wide or popped out, it might be more than just your natural appearance. This could be a symptom of hyperthyroidism, a condition where your thyroid gland, located in your neck, makes too much thyroid hormone. The most common cause of this is Graves' disease, an autoimmune disorder. When this happens, the tissues and muscles around your eyes can swell, causing your eyes to bulge outward, a condition known as exophthalmos. You might also notice symptoms like a racing heartbeat, nervousness, unexpected weight loss, shaking hands, or feeling hot all the time. In severe cases, bulging eyes can lead to eye pain, dryness, double vision, or even vision loss if left untreated. So if you or someone else notices your eyes suddenly looking more prominent, especially along with other symptoms, don't delay. See a doctor right away. Early treatment can protect your eyes and help control your thyroid. Clubbed fingers. If your fingertips start to look thick, rounded, or swollen, almost like the shape of a drumstick, this is called finger clubbing. It usually happens gradually, and your nails may start to curve more than usual when viewed from the side. This change can be a warning sign of serious health problems, especially those that reduce the amount of oxygen in your blood. Common causes include lung diseases like lung cancer, chronic bronchitis, or pulmonary fibrosis. It can also be linked to heart diseases, such as congenital heart defects or heart infections. Because finger clubbing often points to low oxygen levels in the body, it's important to take it seriously. If you notice this change in your fingers, especially along with other symptoms like a persistent cough, chest pain, or trouble breathing, see a doctor right away. It's your body's way of telling you that something deeper might be wrong. Early diagnosis could make a big difference. Red palms. If your palms suddenly become unusually red, especially around the base of your thumb or little finger, it could be a sign of an underlying health issue. This condition is called palmar erythema, and while it can sometimes be harmless, it is often linked to liver problems, particularly liver cirrhosis. Cirrhosis happens when the liver becomes scarred from long-term damage. This can result from chronic alcohol use, hepatitis infections, or fatty liver disease. The redness in your palms is caused by changes in blood flow and hormone levels that occur when the liver isn't working properly. Red palms are usually not painful, but if they appear along with other warning signs like yellowing of the skin or eyes, jaundice, constant tiredness, a swollen belly, or easy bruising, it's important to see a doctor immediately. Catching liver disease early can help prevent further damage and improve your chances of recovery. Purple skin patches. If you notice small purple or dark red spots on your skin that don't hurt and you didn't bump into anything, it could be a warning sign. These spots, known as petechiae, small dots, or purpura, larger patches, often show up first on your legs or arms and might look like a rash or bruising. They can be caused by problems with blood clotting or vasculitis, which is when your blood vessels become swollen and inflamed. These issues can reduce proper blood flow or cause bleeding under the skin. Sometimes this could be linked to infections, autoimmune diseases, or serious conditions like leukemia. If these spots appear suddenly, without injury, and especially if you also feel weak, have a fever, or notice other unusual symptoms, it's very important to see a doctor right away. These marks could be a sign of internal bleeding or a serious immune or blood disorder, and early treatment can be life-saving. Cherryangiomas. Cherryangiomas are small, bright red or purple bumps that can appear on your skin, usually on the chest, arms, or back. They are made up of tiny blood vessels and are usually harmless, especially if you've had a few for years. However, if you suddenly start seeing a large number of new cherryangiomas appearing in a short period of time, it could be a warning sign of liver toxicity or other liver-related issues. When the liver isn't working properly, due to things like alcohol damage, medication side effects, or fatty liver disease, toxins can build up in the body, leading to visible changes in the skin. If these red spots show up along with other symptoms like fatigue, yellowing of the skin or eyes, jaundice, abdominal pain, or nausea, it's important to get checked by a doctor right away. While cherryangiomas alone are usually nothing to worry about, a sudden increase combined with other symptoms could mean your liver is in trouble and needs medical attention. Red butterfly-shaped rash across cheeks. If you develop a red rash across your nose and cheeks that forms a butterfly shape, it could be a warning sign of lupus, a serious autoimmune condition. In lupus, your body's immune system, which normally fights off infections, mistakenly attacks your own healthy tissues. This type of rash, known as a malar rash, often appears after sun exposure and may look like a sunburn. It typically doesn't itch or hurt, but it's a visible signal that something may be wrong inside your body. Other common symptoms of lupus include extreme fatigue, joint pain or swelling, fevers, and sometimes hair loss or chest pain. Because lupus can affect many organs, including the skin, kidneys, heart, and brain, it's important to catch it early. If you notice this butterfly-shaped rash, especially along with other symptoms, see a doctor right away. Early diagnosis and treatment can help control the disease and prevent serious complications. Swollen, tender belly. If your belly becomes swollen, tight, or painful to the touch, it could be a sign of ascites, a condition where fluid builds up in the abdomen. This usually happens due to serious liver problems, such as cirrhosis, scarring of the liver, or liver cancer. As the liver becomes damaged, it struggles to filter fluids and maintain proper blood flow, causing fluid to leak into the belly. The swelling may come on slowly or suddenly, and the stomach can feel heavy, hard, or bloated. You might also notice yellowing of the skin or eyes, jaundice, nausea, vomiting, weight loss, or a feeling of pressure when breathing. Ascites isn't just uncomfortable, it's a sign of major organ distress and can lead to dangerous complications like infection or kidney failure. If your belly swells quickly or feels unusually firm and painful, go to the emergency room immediately. This condition needs fast medical attention to avoid life-threatening outcomes. White patches in the mouth. If you notice thick white patches inside your mouth, on your gums, or on your tongue that don't wipe off easily, it could be a condition called leukoplakia. These patches are usually painless and may feel rough or slightly raised. Leukoplakia is often caused by irritation from smoking, chewing tobacco, or alcohol, but it can also happen without a clear cause. While not always dangerous, in some cases, these patches can be an early sign of oral cancer, especially if they begin to change in size, shape, or color. If the white patches persist for more than 2 weeks, start to feel sore or irritated, or appear alongside other symptoms like mouth pain, difficulty swallowing, or unexplained bleeding, it's very important to see a doctor or dentist right away. A quick checkup and biopsy can help rule out cancer or catch it early when treatment is most effective. Yellow skin or eyes. If your skin or the whites of your eyes turn yellow, it's a condition called jaundice, which means there's too much bilirubin in your body. Bilirubin is a yellow-colored waste product made when your body breaks down red blood cells. Normally, your liver filters it out, but when your liver isn't working properly, bilirubin can build up in the blood. This is often a sign of liver disease, such as hepatitis, cirrhosis, or liver cancer, and may also happen if there's a blockage in your bile duct, which carries bile from the liver to the intestines. If you notice yellowing of the skin or eyes, especially with dark urine, pale stools, itchy skin, belly pain, or nausea, see a doctor immediately. These are signs your liver may be in trouble and needs medical attention. Sudden rash with swelling. If you suddenly develop a rash along with swelling, especially around your face, lips, tongue, or throat, it could be a serious allergic reaction called anaphylaxis. This condition can happen quickly, often within minutes, and can block your airways, making it hard to breathe. Common triggers include foods, like nuts or shellfish, insect stings, medications, or even certain chemicals. Along with the rash and swelling, symptoms may include dizziness, a drop in blood pressure, trouble breathing, chest tightness, or a fast heartbeat. Anaphylaxis is a life-threatening emergency. If you or someone else shows these symptoms, call emergency services immediately and, if available, use an epinephrine injector, EpiPen. Every second counts. Fast action can save a life. Spoon-shaped nails. If your nails start to curve upward at the edges, forming a shape like a spoon, this condition is called koilonychia. It's not just a cosmetic issue. It can be a sign of severe iron deficiency anemia. Iron is essential for making healthy red blood cells, which carry oxygen throughout your body. When you don't have enough iron, your body struggles to deliver oxygen to your organs and tissues, which can cause your nails to become thin, brittle, and scoop-shaped. Other symptoms of iron deficiency anemia include pale or dull skin, constant fatigue, dizziness, weakness, headaches, and shortness of breath, especially during physical activity. In serious cases, low iron levels can put extra stress on your heart, increasing the risk of heart problems. If you notice spoon-shaped nails along with any of these symptoms, it's important to see a doctor right away. A simple blood test can confirm the issue, and with proper treatment, such as iron supplements or dietary changes, your symptoms can improve. Scalp tenderness. Scalp tenderness, especially around the temples or the sides of the head, can be more than just sensitivity to touch. In people over 50, this discomfort could be a symptom of a serious condition called temporal arteritis or giant cell arteritis. This is an inflammatory disease that affects the blood vessels in the head and can lead to major complications such as vision loss, stroke, or permanent nerve damage if left untreated. Common signs include persistent headaches near the temples, pain when combing your hair, jaw pain while chewing, and sometimes even blurred or double vision. Because the symptoms can worsen quickly, it's essential to see a doctor immediately if you experience scalp tenderness along with any of these other warning signs. Darkened skin creases. If you notice dark, thick, and velvety skin developing in body folds, such as on the back of your neck, underarms, or groin, it could be a condition known as acanthosis nigricans. This skin change is often a sign of insulin resistance, which is a major risk factor for developing type 2 diabetes. It may also appear in people with obesity or hormonal disorders, and in rare cases, it can indicate the presence of internal tumors, especially in the stomach or liver. If these dark patches appear suddenly, spread rapidly, or are accompanied by other symptoms like unexplained weight gain, excessive thirst, or frequent urination, it's important to consult a healthcare provider for a full evaluation. Early detection can help you manage or prevent more serious conditions. Painful red joints. A joint that becomes suddenly red, swollen, hot, and extremely painful should not be ignored. This could be a sign of gout, a type of arthritis caused by a buildup of uric acid crystals in the joints, often triggered by certain foods, alcohol, or underlying metabolic issues. Another possibility is septic arthritis, a dangerous bacterial infection inside the joint that can quickly damage cartilage and bone. Both conditions require prompt medical treatment. Gout can be managed with medication and dietary changes, while septic arthritis may need immediate antibiotics or surgical drainage. If symptoms are accompanied by fever, chills, or an overall feeling of being unwell, it's crucial to get urgent medical help to avoid permanent joint damage. Facial drooping on one side. If one side of your face suddenly droops, particularly around the mouth or eye, it could signal Bell's palsy or a stroke. Bell's palsy is a temporary nerve condition, often caused by a viral infection that leads to facial muscle weakness. While it can be alarming, it usually resolves on its own with treatment. However, similar symptoms can also indicate a stroke, which is a life-threatening emergency. The key is timing and the presence of other signs like slurred speech, arm weakness, dizziness, or confusion. If facial drooping comes on suddenly and is paired with other neurological symptoms, don't take any chances. Call emergency services immediately. Scaly, crusted patches on elbows or knees. Thick, scaly, and often itchy patches of skin on the elbows, knees, or scalp may be a sign of psoriasis, a chronic autoimmune skin condition. While psoriasis primarily affects the skin, it can also extend to the joints, causing psoriatic arthritis. This condition leads to pain, swelling, and stiffness in the joints, especially in the fingers and toes. If left untreated, it can cause permanent joint damage. Psoriatic arthritis often develops years after skin symptoms first appear, but in some cases, joint problems might occur first. Seeing a doctor for early diagnosis and treatment can help manage both the skin and joint symptoms effectively, improving long-term quality of life. Lumps in the neck. Finding one or more firm lumps in your neck can be concerning, especially if they don't go away after a few weeks. While many neck lumps are caused by swollen lymph nodes due to infections, persistent or growing lumps may be a sign of something more serious like lymphoma, thyroid cancer, or metastatic cancer that has spread from other parts of the body. Warning signs to watch for include night sweats, unexplained weight loss, fatigue, or pain in the lump itself. If you have any of these symptoms, or if the lump feels hard and immovable, you should consult a doctor immediately. Imaging tests and biopsies may be needed to determine the exact cause. Swelling in legs. If your legs or ankles appear swollen and leave a dent when pressed with a finger, it's known as pitting edema. This kind of swelling is not just from standing too long. It often signals a more serious underlying issue such as heart failure, kidney disease, or liver cirrhosis. These conditions can cause the body to retain excess fluid. Other signs may include tight-fitting shoes, deep sock marks, difficulty breathing, and reduced urination. If swelling comes on suddenly or gets progressively worse, it's important to seek medical attention right away. Diagnosing the cause early can help prevent complications like fluid overload, organ damage, or blood clots. Sudden hair loss. Hair loss that happens suddenly and in circular patches might be alopecia areata, an autoimmune disorder in which the body attacks its own hair follicles. This condition can affect people of all ages and genders and is sometimes triggered by stress, illness, or genetics. While alopecia areata itself is not life-threatening, it may be linked to other autoimmune diseases such as thyroid disorders, lupus, or vitiligo. You may also notice nail pitting, changes in skin color, or fatigue. If your hair starts falling out in clumps, or if bald spots rapidly appear on your scalp, eyebrows, or beard, it's best to consult a dermatologist or physician to check for any underlying systemic conditions and discuss treatment options. Red eyes with light sensitivity. Eyes that are persistently red, painful, and sensitive to light could be a warning sign of uveitis, an inflammation of the inner layers of the eye, or acute glaucoma, a sudden and dangerous rise in eye pressure. Both conditions can result in vision loss or permanent blindness if not treated promptly. Uveitis is often linked to autoimmune diseases like rheumatoid arthritis or sarcoidosis, while glaucoma may strike suddenly with symptoms such as eye pain, blurry vision, nausea, or seeing halos around lights. If you experience red eyes along with light sensitivity or sudden changes in vision, don't wait. See an eye specialist immediately. Curved spine in adults. A noticeable forward curve in your upper back, commonly referred to as a hunchback, may indicate kyphosis. In adults, this condition can develop from osteoporosis, which weakens the bones and increases the risk of fractures, especially in the spine. Other possible causes include degenerative disc disease, poor posture, or spinal infections. As the curvature worsens, it may lead to back pain, reduced mobility, difficulty breathing, and a visible loss of height. If you notice new or worsening rounding of the upper back, especially with pain or fatigue, a medical evaluation with spinal imaging can help diagnose the cause and guide appropriate treatment, including physical therapy or medication. Toes turning blue or purple in cold. If your fingers or toes turn white, then blue or purple when exposed to cold or stress, you may have Raynaud's phenomenon. This condition causes blood vessels to narrow excessively in response to temperature or emotion, temporarily cutting off blood flow to the extremities. In many cases, it's a harmless but uncomfortable condition. However, when it's associated with autoimmune diseases like scleroderma, lupus, or rheumatoid arthritis, it can signal more serious complications. Over time, severe cases may cause skin ulcers, sores, or even tissue damage if blood flow is severely limited. If your symptoms are frequent, prolonged, or occur even in mild temperatures, or if your fingers remain discolored after warming, seek medical advice to rule out underlying causes. Sudden hair whitening. Although it sounds like a myth, sudden whitening of hair, known as canetes subita, can happen, usually in patches. It is most often related to autoimmune conditions such as vitiligo or alopecia areata, which attack hair pigment cells. In other cases, it may result from severe emotional stress, thyroid dysfunction, or vitamin B12 deficiency. While rare, this symptom should not be ignored, especially if it's accompanied by other signs like hair thinning, fatigue, weight changes, or brittle nails. A doctor can help identify whether hormonal imbalance, nutritional issues, or autoimmune disorders are to blame. Finger joints enlarging symmetrically. If you notice swelling, stiffness, or enlargement of the same joints on both hands, especially in the morning, it could be an early sign of rheumatoid arthritis, RA. RA is an autoimmune disease in which the immune system mistakenly attacks healthy joints, causing inflammation and eventual joint damage. The condition typically affects the small joints first, such as the knuckles and wrists, and may come with symptoms like fatigue, low-grade fever, or general weakness. If not treated early, it can lead to permanent joint deformity and loss of mobility. Rheumatologists can help manage RA through medications, therapy, and lifestyle adjustments. Abnormal hair growth in women. Women developing thick, dark hair in places like the face, chest, or back may be experiencing a symptom called hirsutism. It's usually caused by excess androgens, male hormones, and is often linked to polycystic ovary syndrome, PCOS, a common hormonal disorder that also affects menstruation and fertility. In some rare cases, abnormal hair growth may be caused by adrenal tumors or congenital adrenal hyperplasia, both of which can affect hormone production. Additional signs to watch for include irregular periods, weight gain, or acne. It's important to see a doctor, especially if hair growth is rapid or appears with other hormonal symptoms, as early treatment can prevent complications like infertility or metabolic disorders. Thickened, enlarged hands or feet. If your hands, feet, or facial features are gradually getting larger over time, like needing bigger rings, shoes, or noticing coarser facial structure, it may be due to acromegaly. This rare condition is caused by a non-cancerous tumor in the pituitary gland that produces too much growth hormone. Because the changes happen slowly, they're often overlooked until the disease is advanced. Other symptoms may include joint pain, deepened voice, enlarged tongue, or headaches. If untreated, acromegaly can lead to serious complications like heart disease, high blood pressure, diabetes, and even early death. A specialist can diagnose it through blood tests and brain imaging. Changing moles. A mole that changes in size, shape, or color could be a sign of melanoma, a dangerous and fast-spreading skin cancer. You should be especially concerned about moles that become asymmetrical, have uneven borders, contain multiple colors, or grow larger than a pencil eraser. If a mole itches, bleeds, becomes crusty, or appears suddenly after age 30, these are additional red flags. Melanoma is one of the deadliest skin cancers, but when detected early, it is highly treatable. Dermatologists recommend doing regular skin checks and getting any suspicious mole evaluated as soon as possible. Dark streak on nail spreading to skin. If you see a dark brown or black streak running along your nail and it starts spreading to the skin around the nail, especially near the cuticle, it could be subungual melanoma, a rare but aggressive form of skin cancer. The spreading of pigmentation to the surrounding skin is known as Hutchinson's sign, and it's often a late warning signal of this type of melanoma. While streaks can sometimes be caused by injury or medication, this specific sign should never be ignored. Immediate evaluation by a dermatologist is critical, as early detection can save your finger and your life.